Good morning, students. Now in this video we are going to study about the drug delivery systems. So there are some modern drug delivery systems which we need to understand along with the routine use drug administration routes. So what is drug delivery system? Drug delivery systems are specially engineered pharmaceutical products which are intended to carry a drug into or within the body in a controlled and predictable or targeted manner. As in, these systems will ensure that the drug is delivered to the body in a very controlled and predictable and targeted manner. So let's see what are the various drug delivery systems. The aim of making these systems is to improve the efficacy of the drug. That means to make the drug more efficacious, more useful, more effective. Convenience for the patient, that is the patient finds it easy to use. Compliance, to ensure good compliance, as in the patient uses or eats the drug and doesn't reject it or doesn't eat it, not that way. Reliability and safety, both it makes the drug more reliable. That means it will achieve its effect and it also makes it safe. So drug delivery systems, if you see, are of four types. Either they are dissolution controlled or diffusion controlled or polymer dispersion based or osmotically controlled dispersion systems. So now the two drug delivery systems which we had seen in the earlier chapter when we discussed the dosage forms. So there we had studied sustained release formulations and controlled release formulations. So sustained release formulations and controlled release formulations, in both of them, the main benefit that we get, so the benefit of both the systems is that the drug becomes longer acting, and longer acting as in it becomes at least 8 to 12 hours acting. So in these cases, when we use a sustained release or a controlled release or an extended release, then we usually have to take the drug only once a day. So that because it becomes a longer acting, so the dose in a day decreases and it makes the compliance easy. So that is the main use of developing a sustained release and controlled release tablet. Now in sustained release, understand the difference between both. In sustained release tablets, the drug particles are coated with different kind of polymers, and the rate of dissolution, the rate of dissolving of polymers is different for different polymers, right? So like you can see here, this is the inert drug core, and here we have green colored drug coated polymers, and here we have blue colored drugs coated polymers. So the rate of dissolution of green is different from blue. This is for representational purposes. So you can see here that after some time the blue ones have dissolved and the drug has liberated from the released, but the green colored polymer drugs which are coated with green colored polymers are still there, and after some time then the whole drug dissolves. So with this, it is a kind of strategic or stratified release or dissolution. So the drug gets released after an interval of time and the polymers make the difference here. The second controlled release system, here you can see that basically there is an inert core, and then this is the semi-permeable membrane. In controlled release system, the drugs are bound by a semi-permeable membrane, and this semi-permeable membrane controls the release of the drug from the tablet or the capsule or the dosage form. Now what happens here is that whatever the drug is released, initially it comes out, and then after that, so the drug which is there in the outer layer, it is dispersed immediately to attain the therapeutic blood levels. After that, the drug in the reservoir, it is released slowly at a controlled rate through the membrane over next 6 to 12 hours. And so you can see after some time, some more drug is released. After some time, this semi-permeable membrane starts getting dissolved and the drug gets released also. So in this controlled release system, there's one more thing, that there are two types of systems. One follows the zero order kinetics and the other one follows the first order kinetics. What do we understand by this? That in some drugs, basically the rate of release, the release of the drug declines as the dosage form is depleted. So as the concentration decreases, the rate of release also declines, right? While in zero order kinetics drugs, the rate of release remains constant. The rate of release is constant, so that means a constant amount of drug gets released over a period of time, over the next 6 to 12 hours. So here, by reducing the frequency, we increase the compliance of the patient. That is the greatest benefit, the greatest advantage. Plus the fluctuations in the therapeutic plasma concentrations is also minimized. So these are two very good advantages. The compliance of patients remains good and the fluctuations in therapeutic plasma concentration is also reduced by using the sustained release or controlled release tablets. The next system that we study is called as osmotic gastrointestinal therapeutic systems. Now here, understand this with this diagram, that the tablet is basically made in two compartment models. There is drug in one compartment and there is polymer, which is pharmacologically inert but osmotically active polymer, which is there in the other compartment. And there's a very small laser driven orifice, and the drug, when it is ingested, when you take it with water, then that water, because this is surrounded by semi-permeable membrane, so it will enter into this drug and it will expand the polymer. So slowly and slowly the polymer will expand, and accordingly the drug will be released from the orifice. So there's a very smart technique. You can see how beautifully they have used this mechanism in the drug delivery. Here the size of orifice is smaller than the osmotic expansion of polymer. So as a result, polymer जितना expand करेगा उसी हिसाब से drug यहाँ से निकलेगी. So that makes the drug delivery constant for at least 24 hours. And this particular fundamental, this system is used in the a drug that is nifedipine. Nifedipine is basically a drug which is anti-hypertensive. So by using this system, this is called as GITS. So this nifedipine GITS, it produces a smooth hypotension. It does not produce as drastic or sudden hypotension. It produces a smooth hypotension over a period of 24 hours. So with this delivery system, we are able to produce this effect. Now coming to the next drug delivery system. Now this is called as a transdermal drug delivery system. In short form, we write it as TDS, right? Transdermal drug delivery, transdermal therapeutic system. Now what is the fundamental here? Now as the name suggests, transdermal means it is basically on the skin. So these are basically devices which are there in the form of adhesive skin patches, right? So these are patches which are going to be kept on the skin. There are various sizes, 5 to 20 centimeters square, and their main action is to deliver the drug in the system in a very controlled or constant, at a very constant rate into the systemic circulation. Okay, now let us understand it from the diagram also. So here this is the drug or the patch. So the patch has got a backing membrane. This blue thing is the backing membrane, the back membrane. Then this black thing is the drug reservoir in which the drug is contained. Then this green is the most important part of this. It is a rate controlling micropore membrane. So this is the one place which actually controls the release of the drug and makes it constant. Then we have this red thing is basically the adhesive, and it has got a primer dose. So for example, a very simple example which all of you must have gone through or which all of you have used is what it is. It is your regular band-aid, isn't it? All of you have used band-aid. Now a band-aid is a very simple example of a transdermal drug delivery system. Band-aid you have seen that there is a backing membrane which is usually skin colored, brown in color. Then there is a small yellow thing in between in which there is drug reservoir is there, which is covered by a rate controlling micropore membrane which is usually yellow in color. And then there is this adhesive with primer dose. Adhesive is there, and the adhesive is not exactly there in the band-aid which is having the dose. The adhesive is just to attach it, but on this rate controlling micropore membrane it is coated with a primer dose. So as we can see with the band-aid that this is a medicated first aid dressing. So in the band-aid you all have seen, I'll open it and I'll show it to you what are the different layers also. So this thing becomes very clear in your mind visually also, right? Now a band-aid has got, one second, I removed it the wrong way. So if I take this structure of the band-aid, now this is the backing membrane, complete membrane. Here we remove this cover from the patch from the adhesive film, and like this it is removed. And then this yellow thing which you are seeing is having the drug just behind this yellow thing. Yellow thing is like a gauze piece and it is medicated. And then whenever there is any cut, you just put this yellow thing there on, suppose there's a cut here, so you put the yellow thing on that cut area and then you paste this band-aid. And it is important that you don't touch this yellow area while you are putting the band-aid, because otherwise the medicated drug which is there will get wasted. It should actually reach the target area. It should actually reach the area which is having the injury. So you should take precaution while opening it to not touch this yellow part, right? So this is the band-aid that we saw, and it is also an example of transdermal therapeutic system. And I think now you have understood it very well. And this transdermal therapeutic system can be used on any place of the skin, can be used anywhere in the body. It can be used on back or abdomen or upper arm or buttocks or chest or mastoid region or anywhere. Right. Now here another thing very important is that this drug is released at a constant rate. This is the most important part, so that it becomes a reliable source of drug delivery. Then the micropore membrane is such that the rate of drug delivery is less than rate of drug absorption. Okay, so the rate of drug absorption is more than the rate of drug delivery. So this basically ensures that the drug is delivered at a constant rate and predictable rate irrespective of the site of application. So here only I'll discuss the advantages. So what are the advantages? What are the advantages of this system? Advantages is that better compliance is there. The patient accepts it, uses it. Then another very important advantage is that it bypasses the first pass metabolism. So first pass metabolism is bypassed, and so the whole drug goes into the systemic circulation and is used. It can be self-administered, so the patient doesn't need somebody. Then just remove the patch and you can remove the or stop the action of the drug, and it provides a constant rate that we have discussed, and very mild adverse effects. Max to max, usually there is erythema at the application site. So these are the side effects. These are the advantages. What are the disadvantages? Now coming to the disadvantages, the disadvantages are that usually it is expensive. You know, band-aids are not very simple, and that is why the poor patients, they just tie a gauze piece. So it is expensive. Local erythema वगैरह dermatitis हो सकता है, and in children, if suppose by mistake they put up a patch which is meant for some elderly, then that can be a side effect for them. Okay, so the important thing is what all drugs can be put by a transdermal patch. So with this system, we can use a nicotine transdermal patch, which is used in people who want to leave cigarettes. So cigarette smoking, cessation of smoking, cigarette mein nicotine transdermal patch is used. Then estradiol transdermal patch can be used in patients like who want to have contraception. Glyceryl trinitrate is used. Fentanyl is one more transdermal patch which can be used, which basically reduces the pain and can be used in cancer patients continuously. Then other drugs which we use are hyoscine. Hyoscine transdermal patch is used in motion sickness. So patients who are traveling to far off places, or who are traveling by air or by ship, or having a long distance travel, usually they use hyoscine patches so that they don't feel the motion sickness. So for various conditions, we have the transdermal patches which can be used. Then next drug delivery systems that we have are called as transmucosal drug delivery systems. Now in transmucosal drug delivery systems, basically patches are there. There are small patches which are stuck to the buccal mucosa. Buccal mucosa is the mucosa inside the cheek, and this buccal mucosa is a very good absorbing surface. So absorption is very good from here. Plus the drug also bypasses the first pass metabolism, which is a very good thing, and so it reaches the systemic circulation very fast. So the drug has a very rapid onset of action here. That is the benefit. Then it is non-invasive, and the best part is you can remove the patch and terminate the action of the drug. So several drugs like nicotine buccal mucosa patches are used in patients who want to reduce smoking or for smoking cessation, right? So this is one example of transmucosal delivery system. Then next we have inhalational drug delivery systems. So in this we have pressurized metered dose inhalers and rotahalers and nebulizers. So this we have already seen in the dosage forms, and we will be further studying them in the chapter on respiratory system when we will study about asthma. Then there is something called as OcuCert. Now word ocular, so the word itself indicates that this is something related to the eye. So these are again small elliptical micro units, and these are placed under the lower eyelid, and the drug which is usually given by this route is pilocarpine. This is basically a cholinergic drug which is used in the treatment of glaucoma. So this pilocarpine OcuCert is used in the treatment of glaucoma, and this releases drug over a period of 4 to 7 days. So this drug, the structure is that there is a reservoir So the reservoir is basically placed between two microporous copolymer membranes. So there are two microporous copolymer membranes, and inside this is the drug reservoir, that is pilocarpine, and through the membranes, when the tear comes in contact with the membrane, tears penetrate this membrane and they dissolve the pilocarpine, and then which is diffused into the eye and it acts. Then we have another delivery system that is called as progestasert. Now progestasert, basically it is made from progesterone, which is the hormone, female sexual hormone, and insert. So an insert which is containing progesterone, and you all must have heard of copper T. So this is basically a T-shaped unit or a device which is then inserted in the uterus. So it is an intrauterine, what you have commonly seen as copper T also. So this is a contraceptive device, which what it will do is, this copper T is basically made up of a copolymer, and it is having progesterone in silicon matrix. So progesterone is present in silicon matrix, and then slowly it is released. It releases around 65 microgram of progesterone every day, and thus it produces infertility. So this is infertility, or what you call as contraceptive. I'll not call as infertility, it is a contraceptive. So as in the patient doesn't become pregnant. So this is progestasert. This is another type of drug delivery system. Then a very unique drug delivery system which is used in cardiology is called as drug-eluting stents. So drug-eluting stents. Stents, we know basically stents क्या होते हैं? Stent is basically a mesh tube, right? And it is inserted in a thrombosed coronary artery by coronary angioplasty, by that procedure. So whenever a patient has a heart attack, then angioplasty is done. With angiography, we come to know the site of blockade, and then with angioplasty, the site of blockade is opened. So how it is opened? Basically, the stent is inserted and it is expanded in that area and kept it. It is left there only so that the coronary artery becomes patent. So this stent is basically what I'll say is the stent is medicated. And what is the medication which is used? These are anti-proliferative drugs, and the name that we use is sirolimus or paclitaxel. So these are the two anti-cancer or anti-proliferative drugs which are used, sirolimus and paclitaxel. So these coated stents or medicated stents are then used in the cardiology, in the angioplasty. The benefit, what is the benefit over a normal stent? That is, it prevents restenosis or rethrombosis to a bigger level as compared to normal stents. So they release this drug over months, and this suppresses the endothelial proliferation and further thrombosis. So this is another type of drug delivery system. Then we have a drug delivery system which is called as computerized miniature pumps, and this drug delivery system is used in insulin, and it is used in type 1 diabetes mellitus patients. So basically it is a portable electromechanical device. It's like a mobile that the patient can carry. So it's a small portable electromechanical device, and there is a continuous subcutaneous injection of insulin. It continuously injects insulin at a constant rate, at a very low basal rate, and that will keep the blood sugar in check. So it is actually programmed to deliver insulin at a low basal rate, right? And pre-meal bolus rates. So before the meal is taken, the insulin needs to be increased. So it basically controls the postprandial glycemia. Once you eat a lot of food, so once the food is eaten, there is a postprandial glycemia. So this pump controls all the things. So this pump is of two types, either a tethered pump. Tethered pump mein the devices like a small mobile can be kept in the pocket or can be attached to the belt, and it is connected by tubing to the cannula, which is inserted subcutaneously in the anterior abdominal wall, and it continues to release insulin at a continuous constant rate. While another type is a patch pump, where the patch is also attached by an adhesive to the anterior abdominal wall near the cannula, and then it provides the insulin. So these pumps, they provide a very tight glycemia control, but they are very expensive. So another disadvantage, I'll say, that they are expensive, and plus they require constant care, as in hygiene has to be maintained, and then the patient has to ensure that they are filled properly, and the site has to be changed frequently, right? Now these pumps, so they are also used for the pulsatile delivery of GnRH, that is gonadotropin releasing hormone. So this is also used for the pulsatile delivery of GnRH. Now coming to the last part of drug delivery systems, so we have liposomes. Now liposomes basically are nano vesicles. They are vesicles which are 50 to 200 nanometer in size. They are made by sonication of lecithin or any other biodegradable phospholipid, and they are then filled with a non-lipid soluble drug and injected intravenously after dispersion in water. So in this liposomal drug delivery system, we have liposomal amphotericin B, which is an antifungal drug, and it is used for systemic mycosis and Kala Azar. We have liposomal anti-cancer drugs, which are delivered by this route, and also monoclonal antibodies. They can be tagged with liposome, and they are being tried for targeted cancer therapy. Now, what is the benefit of liposomal drug delivery system? That we get a controlled release of drug, as well as we get a site targeting. So it is able to reach the target site, and selectively the drug is taken up by those sites where the action is required. Suppose there's a tumor, so it reaches that tumor site and it acts there. It also protects, liposomal tagging protects the drug from degradation and clearance, improves the efficacy, and also reduces the toxicity of the drug. So this is a liposomal drug delivery system. Similarly, we also have another drug delivery system which is called as nanosomes. What are nanosomes? Nanosomes are 10 to 100 nanometer size. Liposomes were 50 to 200. Here they are 10 to 100. So these are called as nanoparticles. And these nanoparticles are then, tagged with the drug, the antibody, monoclonal antibody, or it can be anti-cancer drug or drugs used in HIV treatment. So they are attached to them. And in this, we get certain drugs which are called as nanosomes or Niosomes, nanospheres, carbon nanotubes, or polymerosomes. So they are being used in the treatment of various type of malignancies, HIV, and other diseases.